It's back and in full force. We're talking about the stomach bug. Doctors and daycare say they're seeing an increase in cases, more than they have seen since COVID hit. Owner of Baby House and Northwest Day School in Greensboro, Ron Kohler, says a number of illnesses have gone through their classrooms as they've eased their restrictions. He says the stomach bug recently hit the younger age groups, but also the teachers. Kohler tells me once it hits, it makes it hard to get rid of.
We do sanitize and disinfect every day, multiple times a day. And we also have a sprayer that we purchased that also is a little bit more high tech that we use on a regular basis just to get as many germs out of these classrooms as possible.
Patricia Williams is a family nurse practitioner with Novant Health. She says she's seen patients of all ages with norovirus, the most common type of the stomach flu. According to Williams, most people are getting sick within 24 to 48 hours of exposure. It then lasts anywhere from 1 to 3 days.
Everybody's back out. We're in our social settings now. We're out in the numbers. And so with that, you're going to see increased numbers of viruses.
Now, if it does hit your household, remember these things. Stay hydrated, drink clear liquids, reintroduce food slowly, and follow the BRAT diet. That's bananas, rice, applesauce, and toast. Now, the best way to prevent picking up this stomach bug is washing your hands and then cleaning linens and surfaces. Williams says that the virus can live on surfaces for up to 2 weeks. Sadly, this went through my house last week. Was that last? That was
it was
last
like
week.
2 weeks ago, I think.
Was it? I don't know.
I
There have
remember
been
you
a lot of
talking
people
about
that have had it.
You were gone.
Yeah, it was not fun.
It is my worst kind of, I'd rather have a high fever. I know that's not what you're supposed to say, but I hate the stomach bug.
I don't like getting sick, period,
Ugh.
so I would like neither, but I do see a lot of things going around. There's lots of people calling out sick, and I think it has to do with we're not wearing the mask anymore, we're all just
exactly.
I think
around
so.
each
I mean,
other.
for the first time in 2 years, we're going out and about and interacting with people without masks on. I hear a lot of coughing and sneezing, which can be allergies too. Speaking of.
Me and Lauren doing that all day
Yeah,
today.
so have I. I've been having to clear
been
my
itchy,
throat.
and I'm like, is it allergies? Is it something else? So
I mean, colds and stomach bugs and all this kind of
It's
stuff, strep, they're things that are just kind of normal, but we haven't seen them in 2 years.
But the easy thing, like she said, wash your hands.
Yes.
You know,
Surfaces, clean surfaces.
sanitize, clean your surfaces, wash your sheets regularly. The same thing throughout the pandemic that we should have been doing before all of this. And hopefully you'll continue those same life skills.
My wife jokes, and some of my coworkers, former coworkers, when I used to work on the Good Morning Show, they said, because I rarely get sick. You know, I might get little things, but I rarely get really sick. And so they said, you're a carrier.
Oh, yeah.
Said, you're a carrier.
I wouldn't be surprised. I really don't get sick that often. I get like one really bad cold a year. And then once the pandemic started, I didn't get a cold at all. And remember, I called out maybe a month ago or something. I felt awful. And it was just a
That's
typical
your one
cold.
time a year.
Yeah, my one time a year. So.
Well, I get sick all the time, so I just have a bad immune system.
So does my wife. Yep.
You need rest. That's what it is. You need some rest.
That's right. The baby's taking the toll.
Maybe in 18 years is what people are telling me.